birth control for women and how it's so bad for you,
Yeah.
and how it messes up your hormone system over long periods of time. Are you seeing a shift amongst women staying away from birth control versus back in the
Yeah.
90s? I feel like everyone was taking it. Now it's almost like taboo to take it.
Yeah, and that's good. I remember when I was put on birth control, well, it was mainly for my acne. I was never informed of the negative effects. I'm just a busy student, barely keeping my head above water, trying to do a PhD all by myself in a brand new country in a field that I never knew about because I was doing nutrition and now I'm doing exercise physiology. So I just wanted a quick patch, a band-aid to so that I'm not being so traumatized by my skin so I can, function and not be so depressed about it. And that's how I think this happens to a lot of students and a lot of younger women. But I feel, I don't know if it's on a case by case basis, depending if you're lucky, if you are informed of all of the side effects or not. My experience with that has been, it never worked for me. My best friend, who's a nutrition professor, gave her acne and she was
Mm.
using it for contraception. It actually made her skin, gave her acne for the first time in her life. So she quit that. I have clients who I've worked with who were taking the contraceptives and I made sure that I got them off of it and I gave them alternatives. And so um, that's been my experience. I don't know if like what's the overall I don't know if everybody feels like it's taboo about birth control. I'm not familiar or I don't know. Um, what I would say is that the problem with conventional medicine is that it does not address the root cause of the problem, right? It doesn't look into what is causing this disease. Let me add one more thing. When I was working at the University of Miami, I worked there on a project where we worked to rehabilitate stroke victims. Every single stroke victim in our study was middle-aged with clear comorbidities. So they had overweight or obesity or high blood pressure, etc. Except two young, very healthy, seemingly healthy women. The only thing that they had in common, they were like in their 20s, less than none of them had even hit 30. The only thing that they had in common is that they were on birth control. That's the only common denominator. It's like how can a 20-year-old, 25-year-old have a stroke that requires rehabilitation? We were teaching them how to walk again, you know. So that's another experience I guess I could add with regards to what birth control pills could potentially do. And it's not like I have zero tolerance to side effects. Sometimes if I have a really bad headache, I'll take a Midol.
Mm.
It's not like it's terrible. It's just that whenever we have an alternative, why should we take a drug? Why should we inject those things into our bodies and clearly mess our hormones? One of the single most important determinants of how healthy you're going to be and how well you're going to age. Why would we ever want to mess with that? A lot of women, when they're taking birth control for a long period of time, they don't get a period. I mean, anything that you put in your body to stop a normal physiological function like menstruation, like just logically, like what exactly do you think is going to happen to your body? Do
Right.
you really think this is harmless? So a lot of women eventually they're off the pill because they want to get pregnant, and guess what? We can't get pregnant. Well,
Yep.
like surprise, surprise.
Yep.
You've been sending a message to your body for decades telling it, I don't want to have a baby. And now all of a sudden you think that you can.